Go ahead.
You've been talking about this sort of one-dimensional. Is there a sensible way of approaching kind of localized people in two dimensions?
We have been doing that. I've developed an instrument right now that is designed for older individuals trying to look at function in multiple dimensions. And I have been testing different combinations of models, and we're finding that we can get at some multiple dimensions using these scales. It adds a level of complexity, but it allows you to get scores on multiple subdomains with a much smaller group of items. So we have been playing around with that, and we're finding some success with it. It's a little harder to explain when you're explaining to people how you generate the scores, but yeah, we are moving in that direction. And we always test for it. Where we can do it, we'll gain some efficiency, then we'll do it. So in this particular tool, we've done it. I've worked in some others, like we just developed a tool for community reintegration of veterans, and I tried to use that technique because we were looking at different elements of reintegration, how frequently they did things, and how much, how limited they were in doing different things, and how satisfied they were. And we couldn't pull it off, so we ended up with very distinct scales. I couldn't get the data to fit the model. So it, yeah. Well, we did that work with Linda Resnick, who's been working at the Providence VA. And she's doing, I think, some very exciting work on what I think is a really incredibly important concept that we're going to be dealing with for those who are working with returning veterans, because they're having a lot of problems with reintegration. The veterans can't get a handle on it. I mean, they don't know anything about it. They don't measure it, so they don't know what to do about it. They don't know whether or not what they are doing is helping the veterans. So we're starting with the measurement.
So are you done with your talk?
Pretty much, but maybe I should just introduce the Boston ROC, because it may be a good place to end. We do have this R24. It's the Boston Rehabilitation Outcome Measurement Center. And what we're trying to do is trying to improve measures that are available to the rehabilitation research community. So that's our basic goal. And we want people to be using better measures. So both we're trying to help invest in the development of better measures, and then trying to help people who are out there doing research use the latest and best that's currently available in the field. So there's kind of a development piece, and then there's a diffusion of innovation piece to our center. And we have research cores, and we can provide technical assistance. We can do consultation. Through that, we frequently will identify promising areas for investment, and we have some money to invest, like you all did in yours. And so we try to initiate some new collaborations and invest in promising areas. We do the dissemination thing and the training thing, so we're scheduling a whole bunch of that. We have a visiting scholar program where we have some modest resources to bring someone to work with our group for over a year period. And we, in terms of investment, we have money for pilots, which we can invest in over a 1 or 2 year period. And predominantly, these are pilots done by people outside of our immediate network, outside of our immediate family. So this is the kind of thing you might be interested in. We currently have money to fund a new pilot starting in June of this year. So I think we're advertising the availability of about $30,000 over a 1 year period. So that's something you might want to give some thought to. We do. That's what the research, we have these research cores, and we do. We try to help the pilot people because they're typically going into some areas that they've not worked in before. So we not only do patient-reported outcomes, that's kind of our shtick, but we work in the area of performance-based measures. Roger Fielding and Jonathan Bean at Tufts and at Harvard are working with us, and we have an instrumented outcomes piece, and that's done by Paulo Bonato over at Spalding Hospital. So all three areas are our game. We're trying to cast a broad net around the themes that we're focused on, And this is our website address. And so if you are interested, obviously you can contact me directly or you can go to our website. But we'd be very interested if there might be a match between what we're doing and what you're interested in doing. So I can probably stop there.